As COVID cases rise across the country, so do cases of anxiety and depression in healthcare professionals. Ashley Sampson is taking a look at how that impacts patients.
It's been said dogs are a man's best friend.
Good boys, good boys.
Jared Johnston is lucky enough to have not one, but two furry sidekicks.
You tired? Tired?
Johnston knows a thing or two about being worn out. Today is a rare day off.
I'm a physician that works mainly in the ICU. I'm a pulmonary critical care doctor.
Since COVID hit, he's been going non-stop.
10 days, 12 days, I'm in the hospital every day. Some days I'm there for 12 hours.
In this video provided by the University of Utah Hospital, you get a glimpse inside the ICU. As a doctor, he's seen it all, but the pandemic is different.
It was definitely a shock to me.
About 2 months in, Dr. Johnston, used to living alone, felt something was wrong.
I just realized that I wasn't doing well.
He made a move, quite literally, he never expected.
I always laugh when I'm a 40-year-old ICU doctor, and I live with my parents.
He moved back in with his mom and dad.
So I tried to do this by myself initially, and I just couldn't do it.
He's not alone.
In medicine, there has been this long tradition of we're fine. We got this.
Doctors and nurses are facing challenges unlike many have ever seen in their career. That's why hospitals like the University of Utah are turning to wellness officers.
Kind of like counseling, it is kind of checking in, making sure that people are doing okay, that they're able to access resources.
At the University of Utah's Resiliency Center, their resources are being used more than ever.
Our interactions with people have more than doubled over the last 6 months.
Doctors like Johnston are applauding the efforts made by hospital groups throughout the country.
In general, the mental health of physicians and nurses and all healthcare workers is something that really hasn't been talked about.
He says talking to other healthcare workers on the COVID front lines is eye-opening.
We're talking about what is it going to look like in 10 years when you have a whole generation of doctors and nurses that have PTSD type symptoms.
As for Johnston, he's found healing in being around family, practicing yoga and meditating. Even after all he's been through these past 8 months, he says he knows he's exactly where he should be.
We've found a calling, a purpose in fighting COVID, in taking care of the people that have COVID. I couldn't imagine myself doing anything else. I wouldn't want to do anything else.
I'm Ashley Sampson reporting.
We're looking at the toll racism plays on mental health when the race continues.